Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Today we are going to talk about a very important subject in children called hemolytic uremic syndrome. I am Professor Nariman Fahmi. I will try in this lecture to know about what do we mean by hemolytic uremic syndrome, how many types are there of this problem, pathogenesis, manifestations, diagnosis, and management of hemolytic uremic syndrome. In these two slides, I want to summarize what we are going to talk about. One of them showing a complete blood picture film that shows fragmented RBC. This is the usual blood film in patients with hemolytic uremic syndrome. It is one of the most common causes of acute renal failure in young children that is characterized by triad of microangiopathic hemolytic anemia, which we can see it in this small picture. And I put the kidney so that we remember that the next important thing we should remember is the uremia or renal failure that found in this disease. So the patient will have hemolytic anemia, uremia from its name, and there will be decrease in platelet count, and we will see how. Thrombocytopenia. There are two types of hemolytic uremic syndrome. The one that preceded by prodrome of diarrhea, this is called typical. And the one that has no relation to diarrhea, it is called atypical. It is mainly due to a defect in complement system in the patient or secondary to autoimmune problem or certain medications like cyclosporine. We are going to talk about the typical form that is preceded by diarrhea, which is usual, most common in children, diarrhea positive, and it's usually transmitted by special strain of Escherichia coli called hemorrhagic E. coli that's found in undercooked meat or unpasteurized milks or salads that contain this microorganism. Usually the microorganism is called hemorrhagic E. coli 0157H7, which is a specific strain of Escherichia coli causing severe intestinal illness that produces a toxin called Shiga-like toxins or protein that damage the capillary endothelium. يعني هذه اللي بدنا نلاحظها بدنا نشوفها بالصورة هاي البكتيريا تطلع specific toxins أو نسميها Shiga-like toxin بروتين اللي تسوي دامج للاندوثيليوم مال كابيلاريز. واحنا مثل ما نتذكر ونعرف انه الجلوميرولاي هي عبارة عن small tuft of capillaries، فاذا الكابيلاريز صار بالاندوثيليال دامج مالتها الار بي سيز اللي حتمر خلالها تصير بها دامج، فتصير عندها fragmented RBC ويصير البيشنت عنده sudden drop of his hemoglobin وانيميا. الدمج اللي يصير بالكابيلاري وول تحاول انه الجسم يصلحها ويدخل من ضمن الاشياء اللي تسوي كوركشن البليتلت، فلذلك البليتلت حتدخل بعملية المانجينج بالكابيلاري وولز ويقل عددها، فالبيشنت معرض للثرومبوسايتوبينيا. الفانكشن اوف ذا كدني نفسها حيصير بها خلل لانه عملية التصليح تكون وياها موجودة inflammatory process وفايبرس تيشو، فيصير عملية الفلتريشن اللي دا تسويها هل tuft of small capillaries نسميها glomeruli تتأذى، فنسميها يصير عند البيشنت features of uremia. So we have the typical اللي هو يجي لي anemia, thrombocytopenia, renal failure. There will be a prodrome of diarrhea. يسموها D positive Shiga toxin producing or acid illness. And it is the most common form in children less than 5 years. Of course there will be epidemics اللي صايرة مرة باليو اس من ماكلين الميت undercooked بالهمبرجر، فصار عندهم مرة صار عندنا another epidemic قريبا في من الخيار بالسلطات بألمانيا أيضا صار بها epidemic قبل فترة. فإذا ممكن تجيلي على شكل epidemics هذه الديزيز. While atypical form there will be no diarrhea before it, and it will have no specific etiological agent. It will be worse prognosis and he has a tendency to recur. لأنه الديفكت مثل ما قلنا قد تكون بالكومبلمنت نتيجة دراج بياخذه أو عنده أوتو أميون مثل الأسلئي، فممكن ترجع أكثر من مرة. The diagnosis is usually supported by finding of these three things اللي هي الأنيميا thrombocytopenia with renal failure. هذه الصورة تبين مرة ثانية الفراغمنتد RBC اللي نشوفها بالبلاد فيل. فاحنا لما نيجي بمريض كان كل شي ما بيه ورأسا نقلل الهيموغلوبين مثلا من 12 صار 4 أو 5، حنسوي له كومبليت نشوف هيموغلوبين لو، بس البلاد فيلم يقول لك fragmented RBC suspected hemolytic uremic microangiopathic hemolytic anemia، فيخلينا نعرف انه مرض مالتنا by specific thing. Renal manifestation, it will vary according to the amount of the damage that happened to the capillary endothelium. It could be mild renal insufficiency, mild increased blood urea creatinine, to very severe renal failure, oliguria, anuria that requiring dialysis. The complication of the disease هي complication مع renal disease of course اللي هي accumulation of acids, electrolyte، يجي لي acidosis, hyperkalemia, volume overload in form of fluid overload, edema, heart failure, hypertension, uremic encephalopathy. البيشنت طبيعي أكيد يجي لي with pallor and anemia لأنه هو أول شيء اللي حيصير عندنا destruction of RBC. The extrarenal manifestation include central nervous system dysfunction، فيجي البيشنت عنده irritability، seizure، coma، قد يكون عنده gastrointestinal like ischemia, inflammatory colitis, intestinal perforation, intussusception، acute pancreatitis، ممكن يصير عنده cardiovascular arrhythmia others. لأنه الكابيلاريز بصراحة موجودة any part of the body وكلها إذا صار بالديسفانكشن فممكن يتأثر in addition to renal impairment، فهاي كلها ممكن نقدر نشوفها. بالنسبة للمانجمنت عندنا لما يجي لي patient عنده sudden drop of blood pressure symptomatic anemia، this is the first of management in addition to early institution of dialysis حتى نقدر نتخلص من الفلويد والأسيدز والإلكترولايت المتجمعة بالبودي. ف early institution of dialysis is very very important in addition طبعا إلى blood pressure control. فتلاحظون هاي كلها نعتبرها conservative. So management include blood transfusion, control of blood pressure, attention to fluid and electrolytes, early institution of dialysis. The antibiotic actually has no role in this disease because when we give it to kill the bacteria, more toxin will be going to released from bacteria and more severe damage to the capillary endothelium. So it's better if it is typical form not to give any type of antibiotic in this disease. بس نسوي conservative management. البروجنوسيس بالtypical form with aggressive management of the electrolyte, blood pressure, volume overload, more than 90% will survive the acute phase of diarrheal problem. but we should follow up these patients for a long period because of damage اللي صار للكابيلاري. فلازم نقيس له blood pressure, renal function every 3-6 months so that we could not يعني escape if there is any bad complication occur later in life. While the atypical form يحتاج another management, sometimes he will need plasma exchange, he will need a form of stabilizer of the complement system like eculizumab اللي هو احنا مو مهم هسه حاليا نعرفه مثل ما نعرف ال typical form, but you should have an idea there are certain other management of other types of hemolytic uremic syndrome. إذا كان secondary to drug you should treat the drug تمام يعني should stop the drug مثل السايكلوسبورين أكثر شيء اللي يسوي. At the end of the lecture, thank you for your listening. I hope you will get the benefit from it.